What happens when a state decides to challenge federal vaccine rules? Minnesota just made one of its boldest public health moves in years, empowering pharmacists to administer COVID-19 shots far beyond the limits set by Washington. But here's where it gets controversial. This standing order breaks with decades of tradition and could leave people debating whose advice should guide our health decisions. On Monday, Dr. Ruth Lynfield, Minnesota's state epidemiologist, signed a standing order that effectively turns every pharmacy into a one-stop immunization hub. No longer do Minnesotans need a doctor's prescription or have to fit into narrow FDA age and health categories. Whether you're a working parent grabbing groceries at 8 p.m. on a Thursday or a college student rushing to class, your neighborhood pharmacist can now give you a COVID-19 shot with the same ease as a flu vaccine. A companion order even opens pediatric doses for children ages 3 through 11 when parents choose protection for their little ones. Historically, Minnesota simply echoed guidance from the FDA and the CDC, following every update from federal authorities. That changed after President Trump named Robert F. Kennedy Jr., a vocal vaccine skeptic, as health secretary. In mid-September, the CDC's Advisory Committee on Immunization Practices, ACIP, stunned observers by opting not to formally recommend COVID-19 vaccines for the general public and instead advised individuals to weigh risks and benefits on their own. And this is the part most people miss. A group meant to translate science into clear policy suddenly pivoted toward personal choice rather than a unified health message. Kennedy and his appointees raised concerns about the cumulative impact of multiple vaccines and questioned whether potential individual risks might outweigh community advantages. Yet every major medical society, from the American Academy of Pediatrics to the American Academy of Family Physicians and the American College of Obstetricians and Gynecologists, has called for unrestricted access to the latest COVID-19 shots for everyone 6 months and older. Minnesota's Department of Health sided with these professional groups, and AHIP, the Trade Association for Health Insurers, followed suit by urging its members to keep covering COVID vaccinations. Until now, pharmacists in Minnesota could only give COVID-19 vaccines under federal emergency use authorizations to people who met strict criteria, typically those aged 65 and older, or individuals with certain underlying conditions. With Lynfield's blanket prescription, anyone 12 and older can walk in for a primary series or booster dose without extra paperwork. That shift aims to tear down barriers to care and reach populations that might otherwise delay or skip vaccination. Public interest in COVID-19 shots has dwindled since the pandemic's peak. By May of this year, only 22% of Minnesotans were fully vaccinated against COVID-19, whereas 34% received flu shots. Respiratory disease season, spanning roughly October through March in Minnesota, brings flu, COVID, and RSV all at once. Layering protection against these three threats can drastically reduce strain on hospitals during the busiest months. Real-world evidence supports the push for broader booster campaigns. The Vision Network, a partnership including Bloomington-based health partners, analyzed data from tens of thousands of emergency department visits last season. It found that vaccinated adults were 33% less likely to seek emergency care for COVID-19, and seniors who got their booster saw more than a 40% drop in hospital admissions. Those percentages translate into thousands of avoided crises, fewer stretched-thin ICUs, and lower costs for patients and insurers alike. The immediate catalyst was an executive order from Governor Tim Walz, who argued that waiting for federal agencies to catch up would leave vulnerable people unprotected. Minnesota isn't alone in this approach. Just last week, Wisconsin state epidemiologist issued a similar directive to speed up pharmacist-based COVID vaccination. Side effects remain rare, but should be acknowledged. A handful of Minnesotans reported tinnitus, persistent ear ringing, following their shots. Though most cases faded within weeks, a University of Minnesota research team's exhaustive summer review confirmed very rare instances of myocarditis, heart muscle inflammation, at roughly 3 cases per 100,000 male recipients of the Pfizer vaccine. In nearly every instance, symptoms resolved quickly with rest and minimal intervention. Even accounting for these risks, the dangers of severe COVID-19 infection still far exceed those associated with vaccination. Michael Osterholm, director of the university's Center for Infectious Disease Research and Policy, openly criticized last week's ACIP meeting. The ACIP we knew has been hijacked, he said, accusing the panel of drifting from a science-based mission to an ideological one. Now Minnesota has drawn its line, daring to pioneer its own path. Does this state versus federal tug-of-war strengthen public trust in health guidance, or does it undermine a coherent national strategy? Will easier pharmacy access truly boost vaccination rates, or leave rural and underserved communities behind? We want to hear your opinion. Are you cheering this move, raising an eyebrow, or finding yourself somewhere in the middle? Join the conversation and let us know.